Unlike most of his American colleagues in the upper echelons of their profession, Ignacio Ramonet, editor of Le Monde Diplomatique, maintains that journalism must be combat, adding, "To be a journalist is to resist an oppressive system run by a norm-producing machine, to tear away the veil and reveal what is hidden, and to think and to write against it." The fact that he acts on these words as an incisive writer and talented editor clearly distinguishes Ramonet from the corporate sellouts, advertising agents, and celebrity hounds one reads in today's papers. That's from chapter 12 of The Arch Conspirator by Len Bracken, Adventures Unlimited Press. Hello and welcome to another edition of the Stench of Truth. I want to talk about a couple things really fast. Okay. Well, the health care overhaul plan passed through the Senate committee, okay, with Olympia Snowe voting for it. Okay, it doesn't seem to have very much in the way of Republican support, which is pretty much what everybody expected. But the very important thing you need to remember is there's no fucking public option in the plan that came out of committee. Everybody's really big on talking about how they're confident that a public option will be in the plan that is finally brought before the full Senate to be voted on. But I've yet to see it fucking happen. So, one thing is for sure. It's not in any of the fucking plans that have been passed out of any committees or you know, made it out of any kind of you know, whatever, conference, whatever you want to fucking call it. There's no public option in any of them. None of them. Okay? Okay, fine. You want to be against the public option, you want to be against government-run healthcare, fine. Fine. Whatever it is you want, that's fine. We don't need to argue about what it is we want, and I'm not here to tell you, you gotta listen to fucking me. You gotta do what you think is important, okay? I've told you before, I'm for single payer. If you're not, that's fine. I'm not here to argue those points, okay? What I'm here to tell you to do is to take the fucking time to do something about the issue, because it is moving forward without a public option. And I needn't tell you that if they mandate coverage for you and they tell the fucking insurance companies that they can't raise your premiums or deny you coverage because you have a pre-existing condition, they have to make up that fucking revenue somewhere. And if you do not have a less expensive option available to you that meets federal criteria, what the fuck are you going to do? That's one of the best reasons I can think of to have a public option. Not to mention the fact that in almost every fucking geographic area in this country, there's one or maybe if you're fucking lucky, two providers that completely fucking dominate the market. So you don't even have the option of getting another fucking company if you wanted it. So yeah, if you want to buy insurance in fucking California and you live in Maine, I think you should be able to do it. That's fine. Open up all the companies to everybody. But can you imagine how difficult it's going to be for that company in California to compete in Maine with whatever fucking companies they have up there that totally dominate their motherfucking market? That's why if you have a public plan that's available equally in every fucking state already, because it's going to be directed by the public, that can serve as an effective competition, because it will immediately be able to compete in those monopolistic environments. But even if you don't want a public option, you got to have fucking problems with the bills that are being put forward, even if they don't include the public option. There are major fucking problems with it. Mandating coverage, for one thing. And the fines, if you don't get it. And there's also the possibility that companies who currently provide fucking insurance to their employees, you know, maybe they're spending 12% of their fucking money on providing insurance to their employees, and then you have this bill that says they can either provide the insurance or they could pay an 8% fine. Well, that's a no fucking brainer, isn't it? Everybody's going to lose their fucking insurance, and that company is going to pay the 8% fucking fine. What's going to happen to all those people? That's why it's essential to have a less expensive option that's available everywhere to everybody. That's why a strong public option is important, in my opinion. But even if you don't support that, you've got to take action on the healthcare issue because it's moving forward and it needs to have your attention. Whatever it is you believe in, flood the fucking House and the fucking Senate with your calls and letters, because as I've told you before, it's vital for us to stay politically active and to encourage other people to become politically active so that we can either force change or force people who refuse to accept the reality to realize that the fuckers who are elected to represent them don't do so anymore. And then, after we've exhausted the lawful means at our disposal, we can think about doing something else to see that our grievances are fucking addressed. The other thing, very quickly, the Financial Regulatory Reform Agency, or whatever the fuck they're calling it, well, apparently some fucking bitch, I don't even know her goddamn name and I don't give a shit, look it up, put a fucking amendment on this already travesty fucking legislation, which is going to do nothing to save people's money or hold fucking banks and financial institutions fucking accountable in the fucking first place. She put an amendment on there to say states can't enact tougher fucking laws. So, for any of you who are really big on states' fucking rights, you ought to be writing to tell the motherfuckers up there to keep their fucking grubby paws off states if they want to enact tougher laws to protect their fucking consumers. Who is the federal fucking government to tell them that they can't? Fuck! Healthcare reform, financial fucking reform. Get on it! Thank you. Good night.